This video is the second in the week 1 of ATTR 810's videos, and I'm going to talk a little bit about injury risks and how that relates to clinical practice after reading the articles for class. And I can't say that I'm very surprised about the current status of literature regarding injury risks. The articles that we read were pretty in-depth and talked about everything from previous injuries to various intrinsic features of the bodies to the shoe type, the surfaces that the patients were participating on. And so there's a lot of information out there for a large amount of ages. I just don't think we as athletic trainers use this a lot. We talked a lot about this in prevention class, that prevention seems to be one of the most overlooked things, and that's because people say they don't have enough time. So people aren't delving into the literature to see how their epidemiological stats line up with that of similar populations, and so maybe athletic trainers don't know the risks that their patients are undergoing every day they go out and play the sport. I really enjoyed, and I'm going to butcher the name, the Mia-Weiss model for sports injuries, and I think it really makes sense. So, like, for the injury to happen, everything has to be in that perfect place. So what can I control? I can control the patients who have had previous injuries or have predispositions for injuries. I can have them on some type of prevention plan or work with them to strengthen something. In addition, just kind of knowing that they're at greater risk is going to help increase their safety. So if I know that, they talked about bracing, so if somebody sprained their ankle, already they're at a greater risk of re-sprain if they do not have ankle braces. So maybe that's something that I go and help inform them on in addition to ankle strengthening, to maybe work on ankle bracing. And so how can I start today to do a better job of risk factor identification in order to improve clinical practice? The article on the outcomes tests were fantastic. So a lot of these don't take that long to do either. And I think it's really easy for me to say this too because I'm not in a full-time clinical practice. But doing some of these tests really don't take that long. I've done them in my clinical practice. And so I think the first step for any athletic trainer is determining which of their patients are at the greatest risk of injury, and I think you got to start somewhere. So in this class, we're in lower extremities. So maybe it's noted with males, ankle injuries were the highest, and with females, knee injuries were the highest. So maybe just starting there, having a test for each would be a good way to start, because I think in all of our clinical practice, we need to do more prevention.